team, the IMST, involving more than 29 partners together. We believe that this becomes a mechanism that will sustain in Africa for all other outbreaks, even Marburg, if today we have more than 2-3 countries affected. And more importantly, we are thinking about decentralizing the lab system. This is one of the Mpox legacies. We are thinking about reinforcing the role of National Public Health Institute and the Public Health Emergency Operations Center supporting that. We are thinking about how to bring appropriate health workforce for our system. I think we have a lot of lessons we are learning, and we call that Mpox legacy. For me, 2025, we need to end with this Mpox and to learn from that. The agenda of local manufacturing remains a key priority for us. As you will know, we'll discuss local manufacturing in Addis Ababa during the AU Assembly. And we have also this meeting the 4th of February in Egypt that will bring a number of ministers and partners to discuss local manufacturing in Africa. We are still committed, Paul, in a number of agendas that we are pushing. We managed to put in our manifesto, because this manifesto is the contract that we have with African countries. You are right to talk about PGI 2.0. I have Dr. Yen, who is our director for lab, is the most appropriate person to talk about PGI 1.0 and 2.0. Over to you, Dr. Yen.
Yeah, thank you, Paul, for that question. After we launched the PGI 2.0, actually it's an extension of our PGI initiative. We are working on 4 objectives already, and there are many things happening. Number 1 was actually expanding the use case of genomic sequencing for other priority diseases. Before, as you remember, on PGI 1.0, we were focusing only on cholera. Now we have expanded our sequencing activity to other Africa priority diseases, cholera, antimicrobial resistance. We have generated robust data on sequencing on cholera, AMR, malaria, Mpox, and other outbreaks. The second one was we continued expanding the capacity to more other countries. During PGI 1.0, we were at 32 countries, and now we have almost 42 at national level. And for big countries, now we are working also to decentralize the genomic capacity to subnational level. And those activities are happening, and we are also expanding our effort in increasing the workforce on both on the lab side and informatics. So we have many short-term and medium-term training programs happening, and we are also working to have even an online training program on genomic sequencing. And finally, the major objective for PGI 2.0 is sustainability of this technology, which is a little bit expensive. So now we have engaged countries to develop national genomic sequencing strategy, and some countries have finalized, like Nigeria and Namibia. So we'll continue supporting other countries. So PGI 2.0 is happening, and we are pushing it, and it will be really a game changer for many of disease outbreaks in Africa. And thank you for that question.
Thank you. Dr. Ngash, about the support to Sierra Leone.
Yes, thank you very much, Kemo, for that question about Sierra Leone. I think what advice can Africa CDC give, learning from the experience of other countries like Rwanda, is that Sierra Leone need to be aggressive from the start to stop transmission before it gets out of control. What will be important is that it is time to put in place the incident management system, and also activate the emergency operation center. That is number 1. Number 2, it is also important right from now to establish the strategic coordination under the leadership of the ministry to ensure that all the key players are very well coordinated under the visionary leadership of ministers to coordinate the contribution of each of them to the response. Now, on the response itself, you need to work on surveillance. Just ensure that you have a very strong surveillance system. There are still very few cases, 2 cases that have been confirmed. Make sure that around those 2 cases, there is an active case search. There's a very good listing of contact and also the monitoring of contact to be able to control the chain of transmission right from now. The second thing is to strengthen the capacity of the laboratory to be able to diagnose these cases right on time, and especially shorten the result turnaround time so that people are not exposed for a long time. The third thing is to also strengthen the surveillance side with really strong risk communication and community engagement and infection and prevention and control in the health facilities, but also in the at community level. And lastly, just identify, make sure that there is a facility that has got the capacity to provide quality case management so that it can really minimize the case fatality rate in the country. I think those are some of the things that need to be established right now to make sure that we can really control this before it goes out of control. Over to you.
Over to you, Margaret.
Thank you, DG. And with that, we have come to the end of the briefing this week. I will now hand it over to the Director General for his closing remarks. Over to you, DG.
Thank you so much for attending this press conference. We are committed in Africa CDC in 2025 to double our effort. We are giving ourselves
it's 3 o'clock.
The munitions to do that. We believe that this year, not only to stop Mpox, but we'll do our best to strengthen the capacity of countries to make the system more resilient. There are a number of shocks we are facing, and we know also we are working in an environment where there are some issues related to financing of the global health initiatives. This is why we are taking strong action to increase domestic resources, as we are sharing for the meeting on the 14th of February, but also to advocate for appropriate funding of some of these global health initiatives, because that will impact Africa. But next week, we'll give you more update on number of outbreaks we are facing in Africa, like the cholera, the suspected cases of Marburg, and also Mpox. We believe we'll have opportunity to meet most of you. I want even to organize a physical press conference in Addis Ababa. And if you are interested to fly to Addis, please don't hesitate to communicate with our Director of Communication. We'll be more than happy to have a dedicated time to discuss more, and even to invite some of our leaders to talk with you on all initiatives that we are taking. And we want to thank all of you for the support you provided to us in 2024. We believe that without press, our community will not be well informed about all of these diseases. We want to thank you, and let us continue to work together to see how we can mitigate the impact of some of these outbreaks that are still ongoing in Africa. Thank you so much.